Okay, we won't keep everyone waiting. I think that Mr. Bitar will join later. Welcome everyone to the fourth Global Lecture Series event hosted by the Eastern Mediterranean region of this International Working Group. My name is Mabel Aoun and I am a regional member of the EMR representative team. And actually the script was prepared by my colleague Lara Abu Ammar, but her connection is too bad today. So I will be moderating the discussion today alongside my colleague Riwa, who will be moderating the Q&A at the end with the Global Lecture Series team. Before we begin our session, I just want to touch briefly on the International Working Group for Health System Strengthening, or what we call IWG. We are a collective of emerging public health professionals from 6 different global regions. Our mission as an organization is to unite the next generation of strategic thinkers and innovators around the world to co-create equitable and sustainable solutions for complex health systems challenges. Today's panel session is the fourth event in a virtual global lecture series we are hosting throughout 2021. And it will discuss how COVID-19 has created a new space for reimagining health systems capable of defying emergencies similar to the current pandemic. The Eastern Mediterranean region has been substantially impacted by this global health crisis, with vast disparities in responses among countries that are diverse in their identities and social and economic conditions. Therefore, health systems in the EMR are in need of reform now more than ever for sustainable, equitable, and consistent access to healthcare. So in today's session, we are delightfully joined by 4 inspiring leaders from 3 different countries, Lebanon, Jordan, and Pakistan. First, Dr. Faji Al-Jardali, who is a recognized health policy and systems researcher and global advocate for the use of science and research evidence in policy decisions and practice. He has extensive international and regional experience and multidisciplinary background in health policy, systems, and management. He is currently the director of the World Health Organization Collaborating Center for Evidence-Informed Policy and Practice, professor and former chairperson of Health Policy and Systems, founder and director of the Knowledge to Policy K2P Center, and co-director of the Center for Systematic Reviews in Health Policy and Systems Research. Second, Dr. Ruwaida Al-Maita, who is a former Minister of Higher Education and Scientific Research, a professor at Jordan University of Science and Technology, a member of the Higher Council of the National Center for Curriculum Development, and a consultant for Her Royal Highness Princess Mona Al Hussein for Health and Social Development. She has significant contributions to the movement of education, social, and health reforms in Jordan and the region. Dr. Al-Maita has held numerous political and academic key positions that helped her to influence education, health, and social policies. She was the first woman in the region to take over the portfolio of the Ministry of Higher Education and Scientific Research, to serve as a president of university and chairperson of the Executive Council of the Arab Women Organization at the Arab League. Third, Mr. Jad Bitar, who is managing director and partner at the Boston Consulting Group. He leads the healthcare practice in the Middle East region. As part of his role, Mr. Bitar provides expert advisory services to a portfolio of public and private sector clients, ranging from ministries to providers and payers. His responsibilities comprise leading large-scale transformation projects, developing national strategies, ensuring operational excellence, and driving innovation for clients. He has deep expertise in leading change in large systems, supporting leadership teams design, implement, and govern these transformations. At last, but certainly not least, Dr. Shahla Zaidi, who is a professor of health policy and systems at Aga Khan University, Pakistan, an associate faculty at the Institute of Health Policy and Systems at AKU, and an adjunct faculty at the LSHTM UK. Dr. Zaidi's work interfaces evidence generation, M&E policy advisory, technical assistance, and capacity building. Her research interests lie in the areas of public-private partnerships, political analysis, and health service delivery, strengthening primary health care and universal health coverage. Her recent work includes assessment of contracting initiatives for primary health care, political economy of multi-sector collaboration for adolescent health, applying a country analysis of Pakistan, and digital health for frontline health workers for immunization. So welcome all, and thank you so much for joining us. We will conduct our panel discussion and it will be followed by a Q&A session. So we encourage you to post your questions in the chat. This is an opportunity to learn from each other, so please feel free to ask any questions, reflect your thoughts, and share your experiences with us. So without further introduction, let us start the discussion. Is Mr. Bitar here yet, or he's still absent?
Unfortunately, I think he's still absent, Mabel.
He's still absent. Okay, so we'll go on with our three panelists, Dr. Jardali, Dr. Al-Maita, and Dr. Zaidi. So our first question for this panel is the following. The COVID-19 pandemic has emphasized the need for a flexible yet strong health system that the EMR region appears to lack, and thus the need for health system reform is vital. In your opinion, what should be the first step towards implementing this reform and reimagining health systems in the EMR region? So who would like to start first by answering this question? Who's ready? Dr. Al-Maita, yes.
Okay, yeah. Let me first thank you all for inviting me to this important event, actually, especially, it's actually designed and organized by our Health Youth Champions. So thank you so much. And I know that His Excellency, Dr. Fadi, was the one to, send the name. So thank you so much. So let's start with the first question, and I would like to start with a quote from the article from the McKinsey and Company. I will start saying that article says it's about beyond coronavirus, the path to the next normal. It says that it's increasingly clear our era will be defined by a fundamental schism, the period before COVID-19 and the new normal that will emerge in the post-viral era, the next normal. So we have normal before and new normal now with COVID-19. This is one era, period, and now the next period is the next normal. Of course, the world with that will witness a dramatic restructuring of health, economic, and social order in which wellness, business, and society have traditionally operated. And the article stated that in the near future, we will see more actually discussions and debates about what the next normal could entail and how sharply it contours our diverge from those that previously shaped our lives. So, and that's what we are doing actually right now with this debate and with this meeting. Therefore, the crisis reveals not just vulnerabilities and challenges, but also opportunities to improve the performance of the health system, as well as other also social, economic, important social, economic, and business systems. My first actually step toward implementing a solid health system is a stronger health workforce, to invest more in the health workforce. We need stronger and more influential health workforce. We know that the COVID-19 crisis has shown over again the crucial role that health workforce plays in our lives. It attests also the power of the slogan that you all know, I'm sure, there is no health without health workers. So no health system also without strong health workers. It also affirmed that investing in health workers is vital for making health for the reality, for all reality, and for global health security and economic growth. Also, according to the conclusion of the United Nations High-Level Commission on Health, Employment, and Economic Growth in 2016, we should focus also on the fact that employment in the health sector is an investment, not a cost. This is very important. And never has this conclusion been truer than today. As we celebrate this year, the year of the health and care workers, 2021, the COVID-19 pandemic gave us the proof that low investments in health systems, and particularly in health workforce, is detrimental to any economy or social development. Let's ask ourselves, what more can shake politicians than population distress and economic shortfall? It is not only health system, but the health workforce across the world are currently keeping major economies from total collapse. So the first thing is to look at stronger and to cultivate stronger youth actually champions in the health workforce. We need more investment. We need more better education. If we're resonating on the health for in all policies approach, a new futuristic approach needs to be articulated toward more influential and powerful profession. This entails, of course, profound changes in the and transformation of our education system, competences, practices, use of technology, evidence-based research and policy collaboration, strategic partnerships, as well as strong leadership. This is, I think, very important. The other thing also, actually, there are some points, but, I want to refer to more, competences and skills in global health, and also the education system should change actually, because we're not focusing in practice or education in global health and public health, of course. And we have to have better competences and skills in that area. And the government also should take actually the lead with the private sector in this one. The other main thing that, it comes, back to back is also the report from the report of the Commission on Social Determinants of Health in the Eastern Mediterranean region. They actually, the group over there, they focus a lot about developing also national social determinants and health equity plans, and establish monitoring framework, as well as generate data on inequities in social determinants and health. So without health equity, we will not also have a strong system. And we know after COVID-19, it will be worsened actually in relation to health equity. So we also need to create the evidence. This is very important. It's very vital to identify priorities and implementation for reducing health inequities within each country. We know that we have the problem of data and evidence in the region, which also severely limit understanding and action of health inequities. There is great need that this evidence should be used, and it has also to have the spirit of social justice to create fairer, healthier society. So I really like the slogan actually by the team, the commission. I'm proud I was one of the team members, that we need to build back fairer. So we need to build back fairer for equity and for health workforce, more investment in health workforce. Thank you.
Thank you, Dr. Almaita. I want to welcome Mr. Rajat Bitar, who just joined us. And I'm not sure if I will just ask the question once more, Mr. Bitar, so you can answer maybe after Dr. Jardali and Dr. Zaidi. So the COVID-19 pandemic has emphasized the need for a flexible yet strong health system that the EMR region appears to lack, and thus the need for health system reform is vital. In your opinion, what should be the first step towards implementing this reform and reimagining health systems in the EMR region? And I would like to ask each one of the panelists to take 3 or 4 minutes to answer this question, so we can have some time in case you have a second comment at the end. Dr. Jardali, what do you think about the first step towards?
Thank you. Sure. Thank you, Dr. Mabel. Thanks for the International Working Group for Health System Strengthening for having us. And actually, I'm delighted to be with the distinguished panelists today, Her Excellency Dr. Ruwaida, Dr. Zaidi, Mr. Bitar. Just quickly, and I don't want to take much time, and I think one of the things that we have certainly learned during the pandemic, that in fact the pandemic has more of a tested the public health capacities and the health system capacities in the countries in the EMR region. I think this is really quite a living proof that many health systems in the region is not yet equipped or are not yet equipped to deal with the current and the emerging and the future challenges. Interestingly, many countries in the region now have actually, the pandemic has been more of a trigger to ignite more of a reform efforts and transformation, and we're seeing this really quite interestingly in many countries. But before I go perhaps of what needs to be done, wanted to push for reform and reimagining health system in the EMR, I just want to mention that many countries in the region still, the health system is mostly curative, it's mostly based on a sick care model, operating in silos, and we're starting to see more about and disconnected, in fact, from the determinants of health in a broader way. Now, what that means that, one of the things we've learned in the pandemic that there were the trade-off between, economic growth and health. And I think many countries have actually realized that and beyond the EMR. But I think one thing, going back to what Dr. Ruwaida mentions, really about smart investments, and smart investments in public health will certainly improve economic growth. And I think this is a hard lesson, I believe, that many countries have actually learned as the result of the pandemic. If you look in the EMR region, we're still, the EMR population represent 9% of the world population, but in terms of the health expenditure, it amounts for around 10% of the, 2% only of the global health expenditure, which means that we need to start investing better in public health and in health system. To do that, we need political, and this, she said it, Dr. Ruwaida, we need really to engage with political forces. We need more of a clear, decisive political leadership in order to steer a new vision for the health sector. And we're starting to see that, in fact, in some countries in the EMR. So what needs to be done? Investing in developing a national emergency preparedness plan. This is very important. Many countries in the region were not prepared and they didn't have an up-to-date, workable plan. That's very important. And some countries did better in the region because they had previous pandemic or some related transmissions where actually they viewed this experience, like Saudi Arabia and others, to learn, and they were much readier than others actually to lead a transformation and to address the challenges of the pandemic. Second, invest and scale up the public health capacities and preparedness in order to have more a proactive response to pandemic. Reorient the system to become more focused not only in curative care, but also in preventive and primary care. Move the universal healthcare coverage from rhetoric to reality. And I know many countries have actually invested a lot efforts in moving toward universal healthcare coverage agenda, but unfortunately not a lot of action. And this is where we need to rethink about the sources of financing. Shift the partnership with the private sector to become much more strategic. We've seen in some countries, private sector opting out, not engaging in the response, at least at the early stage. And what that means, how to move from contractual agreement to a real partnership and strategic purchasing. More of engaging with the civil society, communities, and more the non-state actors, because they played a very important role in many countries, not only in the region and beyond. how to use evidence in decision making. We've seen many countries, although we had the same evidence, we had the same guidelines, many countries have responded differently at the time of response at the pandemic. Which means how they are using evidence, how they are accessing experts in health system and public health, how they are integrating this in the day-to-day operation. I think this is very important. And the last two things I want to mention is really certainly investing in health information system. We're seeing now how important it is to generate relevant, credible, timely, high-quality data in order to provide real-time contextualized policy response, which means we need to invest in digital health, data innovation, social innovation, and technological advancement in order to address the current crisis, which is still in the middle of the battle now, and also better prepared for the future. Over.
Thank you, Dr. Jardali. So, Dr. Zaidi, if I may summarize, Dr. Ruwaida chose the stronger healthcare workforce, and Dr. Jardali started with a smart investment in public health. What would you choose?
If I talk about choosing, I think I would first backtrack a bit and talk about what was different about what lesson did we learn from the pandemic. And I think the strongest lesson that at least I learned from Pakistan's experience, but also other countries, was just, a whole of health systems approach to tackling a national emergency, or rather a global emergency. What I did see was the traditional silos between disease control programs, between health service delivery networks, between communication channels, between disease reporting and surveillance, all that breaking down to quickly respond to the pandemic. So I think that was a huge lesson, that a shock actually was a trigger, a catalytic trigger to bring different parts of the systems together for responding. It's true enough that response was not optimal. All countries were trying to catch up with the response. Everybody was unprepared. But this shock did trigger a lot of the silos breaking down and for the systems coming together. So I think for Reimagine health systems, the whole of systems approach, which includes supply chains also, is very important. The other lesson that I picked up, at least from the pandemic, is that what is the role of health in tackling shocks and emergencies, whether these be pandemics, whether these be climate change disasters, or whatever else. So if we talk about just pandemics and disease control, the very important area which Faji also mentioned is global health security. And I think within that, a lot's been talked about already, but I'll just talk about a critical area, which is the how. To build this area forward, I think the health sector, or rather the actors in the health sector, need to also share leadership with other sectors. And we come back to the whole debate about multi-sectorality, because health's role is critical in providing technical guidance for global health security. The implementation of global health security is a very distributed function across border controls, across centers and provinces, or centers and states, across a whole variety of states, organizations, across people, across private sector. So I think if health understands its role of technical guidance, of catalytic monitoring, and provision of advice and planning to take this forward, but distributes the responsibility of implementation, I think that will open a window for a reimagined health system for pandemics. Over. Thank you.
Thank you, Dr. Zaidi, for this very interesting choice. Mr. Bitar, do you need a summary, or can you answer?
No, I can build. Thank you, Mabel. First, thank you for inviting me, and thank you for the other panelists for their answer. I just want to build a lot of great ideas have been shared from the experience we had at BCG supporting more than 40 countries across the globe with the pandemic. What was interesting, if I can say, is the most important thing is that most governments were reactive to this situation. They were taken by surprise. It was like they were not even, they didn't have it on their radar screen. It wasn't a priority. The second thing, it was the lack of data regarding what the issue was, regarding their population needs, what to do. So there was, we were basically flying in the first few weeks in the total dark. We didn't know what was happening and where it was happening. And once we started collecting the data, there was a lack of tools to use the data and be able to guide the response. So what do we do? So most government decided to go to a full shutdown. It was a very easy decision to shut down the economy, but the cost was very high. And this was because there was no tool to be able to use the data to have a less drastic response, to have a much more, I would say, nuanced response. So if I step back and look at the lessons from COVID, I think one of the major lessons is that government cannot go at it alone. The private sector was very important, a very important partner to help solve the crisis. However, the governments need to define this role for the private sector and not let the private sector run amok. Two is that in countries where the ministries of health were integrated at the same time, regulators, providers, and payers, we saw the breakdown of these systems because of conflict of interest. So when we look at countries where the MOHs are really regulators and trying to keep everyone in check, we had a much robust, a better answer than when we have this conflict of interest brought all of these roles into a single entity. And the third lesson is that we need a lot of data, and data is not only about the pandemics, but about our population health, about our population needs, to be able to allocate our resources. As you all know, healthcare needs and healthcare demand in systems that are public is quite infinite, and hence no government can sustain all the needs of their population. So it's very important to be able to allocate resources to the right priorities. And for that, you need to have the right data and the right tools to do that. So I'm summarizing a bit. I'm echoing a lot of what my colleagues have said, but these are for me the main lessons out of the pandemic.
Okay, thank you, Mr. Bitar. So we thank you all for these inspiring ideas. I will go to the second question of this panel. Intersectoral collaboration has shown to be at the core of a successful public health response and ultimately of a successful public health system. How can the EMR countries implement and sustain intersectoral collaboration in health and integrate health in all policies in aim to mitigate inequities and prioritize social justice? Maybe we can start by Dr. Zaidi, because you actually already talked about the importance of the health sector to collaborate with other leaders from other sectors. So we would like to listen to your opinion regarding this.
Right, thank you. So I think multisectorality did happen in almost every country, because this was during COVID, the response was really driven by a much higher level. Health was contributing as an integral part, but the championing was from much higher up because of the complexity of the response. So I think if we talk about multisectorality, it differs from issue to issue. What I would say is, for other sectors to either collaborate or be very actively involved, or even to feel that issue is their own, for them to buy in and contribute, what's really important is that they see their own role and they also see the relevance and the impact of that issue on their own working. Once that is established, then it's easy for sectors to buy into the health issue. So with COVID, for example, if you talk about let me give you the small example from Pakistan. A lot of the SOPs for COVID for the general public, not for health service providers, but for the general public, were coming from our home and interior department on, what transport is allowed, how many people allowed, this, that, what must be closed, what must not close. So once the centrality of the agenda and its relevance is bought into by a sector, they automatically come on board because they feel that is their issue also. So I think that is one way to bringing a health issue on the board. The challenge is that this was an emergency. What about issues which are not regarded as an acute emergency? How do you bring that on? And for that, a certain level of sensitization as well as political championing, I think, is required.
Okay. Thank you, Dr. Zaidi. Who would like to follow?
I can build on that. I think one of the, and maybe to reinforce some of the points that already been mentioned by Dr. Zaidi, just certainly the pandemic, in fact, accelerated reforms in many countries, as I mentioned before, but also it really emphasized the importance of how we can move into a multi-sectoral action. And in fact, we just finished a project assessment in different countries, and this will be hopefully published soon. But just really, we looked at the experience of different countries in the region, selected ones, about the multi-sectoral actions related to that. Now, what we have seen that the majority of the countries in the MR established a national multi-sectoral coordination mechanism in time to deal with the responsive plan. However, the mandate and the influence of those, I would say, committees, it was just mostly to address the particular part of how we can deal and respond during the pandemic. So much of their work were not mandated by a decree or a law or any type of regulation. It was just more of a responsive, and this is also what Mr. Bitar mentioned, that many countries were more reactive, and they were not really proactive when it comes to response. So which means I think one of the things we've seen from the work that we have done, that to ensure multi-sectoral coordination mechanism, you need to make sure countries have those entities have a clear mandate, they have a clear action plan, they have adequate resources, they have the right regular reporting, accountability, authority, legitimacy, decision, making pathway, and robust communication. So many countries, they've created those entities just because they want to deal with the pandemic. So how to actually create a permanent a multi-sectoral structure and mechanism in the country to ensure much more sustainable approach to that, I think this is really quite important. So, for example, we've heard a lot about health in all policies, many years in the region and beyond. But I say that, still, it has been more rhetoric than real action. Now, if you look at what we have seen in the response of the pandemic, it requires all sectors to come together. Now, the question is, do those sectors have shared benefits? Do they have a clear shared goal? Do we have commitment at the leadership level? How we can make sure coherence, policy coherence? There was a lot of conflicts, and many policies, when the rubber hit the road, they were actually conflicting, coming from different sectors. How we can synergize and have a policy coherence and make sure that sectors are held accountable in terms of their response. So institutionalizing health in all policies required structures, required processes, required legislative mandate, requires a long-term change in the existing culture in terms of sustainability. And I think these are important lessons. I'm hoping that the pandemic is not a missed opportunity for several countries in the region, that hopefully it is an opportunity in order to actually integrate and create those sustainable entities. This being said, several countries in the region are actually making important strides in terms of moving this forward and learning from the pandemic in a very strategic way. And this is really quite promising. Over.
Maybe I can take a concrete example. One of the biggest problem we have in the region is RTAs, road traffic accidents, which is a typical multi-sectoral issue. And when we look at examples, if we take RTA, you need the Ministry of Health, you need the Ministry of Interior, you need the Ministry of Transport, you need many other government entities, Ministry of Education, to come together to deal with RTA. MOH cannot solve it, MOI cannot solve it, Transport cannot solve it on its own. And when we see these kinds of committee that Dr. Jardali mentioned created to coordinate, we don't see a lot of results. One is we don't have anyone accountable to get these results. So the ball gets passed between those different ministries and entity. And often their priorities are different. The MOH has a priority to focus on emergency medical services to basically transport RTAs to their hospitals, where the MOI is focusing more on traffic safety and so on and so forth. The few examples where, at least that we've seen recently, and we hope that will lead to more impact, is when such committees are created with one entity is held accountable, and all the other entities have a priority and a KPI that the government will hold them accountable against. Without that, it becomes very hard to expect these huge entities to collaborate on such different topics, to allocate the right resources and to allocate the time from the decision makers within these ministries to get anything done. So I'll give an example, for example, in Saudi Arabia, where such a committee was created, headed by the Minister of Health. And this committee had all of these other ministries included, the ministers themselves, and they were tasked to come up with a plan to reduce RTAs in the kingdom. And what you see now is that this committee reports to the government, and each one of these ministries have a specific KPIs that contributes to the reduction of RTAs that they're accountable for. And a budget was allocated to this program. So it's not from the ministries themselves, it's from the government, that to basically encourage these ministries to come together and to avoid this fight over resources. Will this solve the problem? I don't know, but at least that's a step in the right direction.
Yes, I also would like to elaborate more. I think that, what's being said by Dr. Bitar, Jardali, and Zaidi, I think it's a very rich actual discussion. I just want to go back again to the health workforce. You might be surprised why I'm doing that. This is very much connected in the intersectoral collaboration and cooperation. If we don't have a strong workforce that is really understand the interplay of policy and politics in health system with other systems, they cannot do it. Dr. Jardali talked about the sustainability of the system. This is very important. That's why we need to prepare and to cultivate this group actually of health professionals who are policy competent, who can influence policies, who can lead policy dialogue, who can lead the discussions, the debate, about the importance of the intersectoral and multi-sectoral also collaboration. We've been talking about this, I think the last one was in 2011 in Rio de Janeiro, I think, right? Talking about the intersectoral and multi-sectoral, but it started in 1978 in the health of all. And then it, adds up to until now about, health in all policies. But actually, like you said, we are not doing that. Maybe we've done that now with the COVID-19, but still we don't have the system like Dr. Jardali said. We need that system, but also we need to have champions, health champions. Unless we have the champions, we will lose the opportunity, because I'm not overemphasizing health, in the whole group. But again, if we have the traffic injuries, yes, we do have the multi-sectoral, but like Dr. Bitar, I'm sure you're saying that still, we need to take the lead as healthcare professionals, because this is the issue of the country, but it has to be actually led by also healthcare professionals with others. but they are the leaders, so they have to be prepared, I think, very well. We know that the simplest actually term of politics refers to the exercise of influence. We need to influence. There will be no sustainability without training and preparing our students as well as our healthcare professionals to be policy, at least, some of them, a critical mass of them, to be policy competence, but every one of them, they have to influence also policy, because we're not talking about the capitals of the countries, we are talking about also remote areas as well as the urban areas. They have to be the ambassadors, the champions over there. And I'm so happy that you as youth, are organizing this issue, this event, because, this is one of the issues actually you need to take for the future, and, to champion all the collaboration, cooperation, the intersectoral and the multisectoral. I think now it will be after the lessons that we have learned from the COVID-19 and other conflict and the crisis, from the refugees and other armed and other conflict. We learned a lot, actually, not only from the pandemic, but still, I think we are doing that very slowly. There must be political will, and I think you as youth, you can make more pressure as students and healthcare providers in your countries and in the region, and you have also to have more voice also in policy influence. That's my message actually for you. Thank you.
Can I add a quick example from Pakistan on multi-sectoral collaboration? What worked, what didn't work. So stunting or undernutrition is a huge problem in Pakistan. And some years ago, we did a study on the political economy of undernutrition, particularly focusing on multi-sectorality and what hinders it and what are the opportunities. And after that, a multi-sectoral platform was formed under the only ministry which had the mandate, which was the Ministry of Planning and Development, which is a supra ministry under which health, education, all the other ministries, food security, WASH, they come under that ministry. So this was taken as the forum which has the mandate. And so that was formed at the national level and then at the state level. And how that is working now is that each of the ministries, so that platform and in the Planning Commission of Pakistan has a nutrition cell, a coalition of networks, of stakeholder networks. And what it's only done is it's used the different ministries to come up with a joint plan and joint monitoring indicators. The resourcing is being provided by each of the different ministries. So there was reluctance of ministries that all the money should either flow to health or should flow from health to other ministries. So each ministry has its own little budget for nutrition, health has its own, and the coordination is around a common action plan. So mandate worked. They weren't willing to come under health, but they were willing to come under planning and development. A favorable donor environment to provide nutrition resourcing helped. Each got their own piece from a donor or from their own funds, and political championing at the level of the Pakistan government helped because we had very powerful champions. So that helps. I think these three factors collided, but I also have examples of less successful collaborations, which we can take forward another time. So thank you, over.
Thank you, Dr. Zaidi. Any other thoughts from the panel? No? Well, I thank you all for this very fruitful discussion, and I am sure everyone has learned a lot from you and what you brought up today. We will take questions from the audience now, so I will hand it over to Riwa to moderate the Q&A.
Yes, thank you so much for this very interesting discussion. We are learning so much from you. So I can see a lot of interesting questions. So I can see from Professor Shireen Hussain, she posed multiple questions that are very interesting. So if you don't mind, Professor Hussain, if you can unmute yourself and ask the questions to the panelists.
Hello, good afternoon and good evening, everybody. I'm Shireen Hussain. I'm a professor of health and social care policy at the London School of Hygiene and Tropical Medicine in the UK. I'm also a founder of a network which focused on healthy aging in the Middle East, minara.org. So my questions are really, first, I really thank the esteemed panel on thinking about the pandemic as an opportunity to reimagine health systems. And I want to pose the question around invisible groups, particularly older people and long-term care needs. So we need that this is a group where they kind of fallen between the cracks. There is a lot of assumptions around what do they need and who can support them. And there is a huge reliance on informal carers. And there is not much efforts in integrating long-term care within universal health coverage. So my question, we know that the pandemic has impacted older people significantly worse, adversely, and there is huge implication on deconditioning due to lack of mobility, isolation, and general well-being. Do you see an opportunity to raise this agenda within this rethinking of health systems and intersectoral working? And I really like the emphasis of Dr. Almaty on the workforce, because this is really important. But can we expand the workforce to include also long-term care workers? So it's really about trying to pose this question, trying to think about the marginalized groups. And when we think about equity and inequity in access and understanding, we know that data on older people is very limited due to the coverage of the current surveys, which really focus on reproductive age. So it's just an opportunity to think this and maybe to use the UN Decade of Healthy Aging as a catalyst for this. So I thank all the panelists in advance.
Yes, anyone would feel free to jump in and answer Professor Hussein's question.
So maybe I can jump in. I think this is a very important, intervention. And maybe it's not an answer, more just I think it's an important reminder, in fact, that we need to keep in mind what has been mentioned, particularly around vulnerable group and also about the aging agenda in general. I think one of the things that we've definitely we are seeing now, not only in the region, even worldwide. I think one of the issue about equity and social justice is really very critical. And I think this is really of the hardcore type of lessons that all countries, even globally, from failure at the level of global solidarity to the level at the regional collaboration, but more at the country level, we're seeing a lot of inequities, I would say, and now we're seeing it in vaccines. In fact, at the global level, rich countries, low-income countries, but also within the same countries, we have also some issues related to vulnerable group. And I think the vulnerable group, including when it comes at the aging and senior people, vulnerable people, and even refugees and others were really quite hit hard at the last of pandemic. I think what I want to say that this is what I mentioned before in terms of our system is based more on curative, but not really thinking across the continuum of care. So that's what, when we say continuum of care, and we want to have an integrated care systems at the country level, we have to make sure that this is really this agenda is very much integrated. That senior aging is really part and parcel of how we are thinking. And I tell you, there is a lot of investment went to hospitals, but not to long-term care facilities, not to communities that actually support aging. We have a lot of maybe lessons that we can learn, but I think the key is really how to use that an opportunity to push for change at the policy agenda and also at the delivery level. Over.
May I elaborate?
Yes, sure.
I think the second question that we have here for the intersectoral and multisectoral also will answer this question. But I want to comment that that's why we have to invest in all opportunities we have in the civil society, in the rural areas, in the small societies, in women. It's in order, to integrate other, important issues like, health inequity, as well as we're talking about the aging and others. We have also the least advantaged children, the least advantaged families. We're talking about poverty, about, other things. I think we have to mobilize the community also as a whole. And that's, what we are talking about, health in all policies. We should move young people, youth. I'm not talking about, the healthcare system or health professions. I'm talking now about everybody, to invest in students, in universities, in schools, in order to help and enhance, the agenda of global health. The other thing also, Dr. Jardali talked about, the vaccines. I think there is, a big failure now in the distribution of the vaccines, especially the inequity, especially, for the developing countries and underdeveloped countries, and those who don't have actually the money to pay. I think part of the education also for the healthcare providers should be also, and politicians, is the health diplomacy. We have also to look at it, much better. And I think this is part of what the WHO is doing, but I don't think it's really enhanced, and it's not really integrated well in our region and other regions. I think health diplomacy is, at the end of any agenda now, when we have the pandemic, where it has to be actually number one on the top of the agenda in order to save, the world. We are not talking about, saving one country and leaving the other. Actually, what's going on also in India is really sad. What's going on, among refugees, it's really sad. That displaced, people is really sad. And this is all failure. When we reimagine, we first, to think about this, to really imagine, what we want for the future. If we don't have equity, if we don't have, people, all around the table, from even the lay people, not politicians, not businessmen, not healthcare providers, we have to bring everybody, around the table, age, population, and disadvantaged groups and others. So thank you so much.
Thank you so much for these answers. Just for the sake of time, I'm gonna take one more question. So maybe Amno, if you can unmute yourself and ask your question to the panel.
Hello, dear panelists. Thank you so much for this wonderful presentation. So I'm Dr. Amna Khalfawi, and I'm a global health professional currently working on an anti-corruption program in North Africa. So I'm really glad that the question of accountability was brought to the discussion in the reimagined health systems. And my question is, what are the lessons learned from the COVID experience related to the mechanisms of accountability that are most suited and on which we should put more emphasis to have a better health system, more access to healthcare, and less vulnerability to corruption in the healthcare sector? Thank you so much. Thank you.
Thank you. So anyone wants to jump in and answer Dr. Amna's question? Mr. Jad, go ahead.
I can give it a try. It's a very complex question. It's a very complex issue. I can think of a few things, but one that I mentioned before is that we have inherent conflict of interest built in our governance structure in healthcare. And fundamentally, I think this is the first step. We need to resolve this. When I ask the regulator to be also a provider of service and a funder, I'm creating a lot of gray zones that enable not only corruption, but a lot of other impacts. So fundamentally, this is a structural issue that government should be aware of, and they should separate the regulator from the provisioning of services and from the funding. That's one thing. The second thing for me, when I hear corruption, if there is a silver bullet, it's transparency. And transparency is fundamental in healthcare. And this is one of our biggest issues, that it's very hard for us to measure what we deliver. There is so much waste in the system. There is so much unproven policies and activities that happen within healthcare that we keep funding, that we keep buying, and there is no proof that the population or even the patient benefits from such interventions. So transparency, not only putting all the data we have and making it accessible to the population, but also being able to measure the outcomes of our interventions and making these available, being able to compare different programs, being able to compare different hospitals. Why should I encourage a hospital that has high mortality rate compared to another hospital? Why should I keep sending patients to hospitals that do not deliver the results where other hospitals deliver results? So I think transparency is very important. And for that, number 3 is data. We really need to have the data. Somebody from the audience mentioned that we do have data. I do not agree, at least in the many.
I think we lost Mr. Bitar.
Yeah.
Countries where of these don't know where they are, and we cannot plan our intervention. Without those, we're opening up a lot of opportunities for corruption, for inequity, and for misallocation of resources.
Can you just build a jump? I know we are out of time, but just for 1 minute, I think this is very important question, and I think we need to keep in mind that accountability cannot be dissociated from political system. So it's very important. When we talk about accountability, we're talking really about different levels: political accountability and bureaucratic accountability. So and these are, and we know there are some critical issues in several countries that when it comes to promoting accountability and transparency. But certainly, as building on what Mr. Bitar mentioned, I think it's very important. One of the areas that need to be better addressed, even from a research perspective, is corruption in public health. And I can tell you, even from the current response to the pandemic, there's a lot of waste, there's a lot of inefficiency, but there is also a corrupted system that they are taking advantage of the pandemic to actually gain financial, or to promote more financial gains because of issues related to conflict of interest, lack of existing structures, functions. And I think we need to better understand that. We need to dissect all those determinants that lead to corruption, but we cannot dissociate it from political commitment, because accountability is also a political question. This is one of the political determinants also of better health. So there's a lot of work, but I agree with Mr. Bitar about the issue about data, about transparency, about corruption. These are important areas that need to be addressed.
Right, thank you so much. I think we are out of time. So this concludes our session.
May I just add one thing that I really like to say always now, it's shared accountability. Instead of accountability, it's shared accountability, by everybody with everybody. Thank you.
Thank you so much. Thank you so much. So I would like to take this opportunity on behalf of the whole International Working Group for Health System Strengthening to thank you so much for attending and for taking part and advancing the conversation. So we want to thank the panelists, each and every one of you. We learned a lot from you, and the GLS team and all of the participants as well. And we hope you will join us for the next global lecture series, which is being hosted by the Western Pacific region team. And they will be doing a very interesting panel discussion involving food and nutrition security, with a focus on how to reimagine responses to health emergencies. And early bird registration has just started. So thank you so much, and I hope you have